All right, next we're going to look at anterior trunk lean and posterior trunk lean. So when we're looking at these, what I like to think of first is let's think about looking at our pelvis. So let's do a quick review on anterior pelvic tilt versus a posterior pelvic tilt. So from a lateral view, make sure it's see there. Remember our natural spinal curvature, there should be a little bit of a curve. So we're looking at those excessive, so an excessive anterior tilt or a posterior tilt. So if this would be my natural tilt of my pelvis, the anterior tilt, we want to look at the ASIS and our PSIS. Remember how we are identifying those areas. So an anterior pelvic tilt, that entire pelvis is going to rotate forward. Notice that increased curvature in my lumbar spine, which is known as that lumbar lordosis. Back to a neutral spine and go into an anterior pelvic tilt. A posterior pelvic tilt then, backtrack. Anterior pelvic tilt, our ASIS is coming forward. So it's a rotation forward of the pelvis anteriorly. So ASIS come forward, PSIS also rotate forward. Remember, they rotate in unison. So a posterior pelvic tilt then, I go from a neutral spine, and then my ASIS, my PSIS are rotating backwards. So I'm flattening that curvature in my lumbar spine. So we go from a neutral spine to a posterior pelvic tilt, I am flattening. Now, the reason I want to do a review of anterior pelvic tilt and posterior pelvic tilt is because these kind of correlate with what type of trunk lean your patient may have. So it's not that it's 100%, this is always what's going to happen, but it's something to at least start to assess. So if somebody has an excessive anterior pelvic tilt, if I would just follow my spine with my pelvis, I'm going to go forward. Now, we want to compensate. People don't want to walk, with their head down, trunk like this. So what they're going to do, and my pelvis has an anterior pelvic tilt, but I'm going to lean back to compensate that. Remember, we want to be center with gravity. If I am having an anterior pelvic tilt and I'm leaning forward, I'm most likely going to fall, or at least I increase my chances of falling. So when someone has an excessive anterior pelvic tilt, typically we will see a posterior trunk lean. So they're going to have that pelvic tilt, and then they're going to kind of hang out backwards so that they are with gravity, essentially. So I'll give you a lateral view here first. So with that posterior lean, you're going to see something like this. They're leaning backwards. Give you front and back. You can see they're going to kind of hang out. My pelvis is still in that anterior pelvic tilt, but I'm leaning backwards. Now, sometimes they're very subtle to depict, especially from a frontal view. It can be hard to depict that abnormality. Now, other times, you can tell that they're hanging out like this, and their back is like this. And just look at that curvature that I'm demonstrating with my posture. Now, one thing too you may notice, so they may always demonstrate that posterior trunk lean, or sometimes you'll notice it almost increases as they walk. So if one leg or glutes potentially may be weaker, they may kind of have that posterior trunk lean as they walk. Okay, now going back to the anterior trunk lean. So back to the pelvis, remember that if we have a posterior pelvic tilt, I don't want to hang out here because I'm going to probably fall backwards. So my body is going to want to naturally kind of lean forward as I walk. So I'm having a flatter curvature in the back, and then my trunk is leaning forward as I walk. Posterior pelvic tilt, trunk leaning forward as I walk. Do a behind view, posterior pelvic tilt, trunk leaning forward. So as you're looking at these videos and as you're assessing, the lateral view seems to be a little bit easier. I can see pelvic tilt. What's going on at the back? Look how rounded my back is from that lean. Sometimes I might have a better or a less kyphosis, thoracic kyphosis, but then I can still see at the hips I'm leaning forward. So just like the posterior pelvic tilt, or excuse me, posterior trunk lean, the anterior trunk lean, sometimes you'll too notice it, so I have my tilt with a step. You may notice it kind of like this, versus just that always leaning forward type of gait pattern. So two different ways that you may see these two gait abnormalities.